Hi, my name is Dr. Mary Martin, and I'm a board-certified obstetrician and gynecologist. I'm also a Catholic, and everything in this video is in harmony with the teaching of not only my faith, but also the other religions as well. The opinions in this presentation are not in harmony with all of the policy statements of the American Congress of Obstetricians and Gynecologists, nor the American Academy of Pediatricians. Specifically, those two medical associations endorse hormonal contraceptives for both women and adolescents. They even recommend that long-acting reversible contraceptives be initiated as first-line contraceptives for adolescents. For reasons for which we will go into later, I believe that hormonal contraceptives are dangerous drugs, and prescribing them is bad medicine. This presentation consists of modules of approximately 5 minutes each for easy watching, and here is what we cover. How the man's body works. The man is always fertile. How the woman's body works. The woman is only fertile approximately 96 hours or 4 to 5 days each cycle. The effectiveness, mechanisms, risks, and side effects of contraceptives. What is the effectiveness of the contraceptive? Out of 100 women, how many will get pregnant in the next year? What is the mechanism of the contraceptive? Do they prevent pregnancy or do they terminate embryos? It depends on which definition of pregnancy you use. What are the side effects? And more importantly, the risks. Side effects might be headaches, weight gain, irregular bleeding. But risks of some include a 50% increase in breast cancer and blood clots, which become pulmonary embolisms. These can and do injure and kill. The barrier methods of contraception. The hormonal contraceptives, pills, patches, injections. LARCs, long-acting reversible contraceptives, hormonal implants, and IUDs. Just what is Plan B? Fertility awareness methods. The Billings ovulation method and several of the more recently developed natural family planning methods. Sexually transmitted infections, bacterial and viral, which can be cured and which are with you forever. This video can be used in many ways. We use it in our practice here at the office. We actually have a program in which we teach and counsel on contraception, and we make reference to the modules in this presentation. Incidentally, all of our educational meetings on contraception are without copay or any other charge to either adults or adolescents, and that is whether the patient is using or not using contraception. The presentation can also be used by those who teach sexual education to adolescents. It can also be used by parents who can watch it with their adolescents. We treat adolescents here. And if the adolescents are interested in learning about contraception, this is one of the tools that we use. In doing so, we are careful not to infringe on the traditional right and obligation of parents to teach sexual morality to their children. And so we encourage that parents participate with adolescents in these educational sessions. As you may already know, an adolescent has a right of confidentiality in seeking health care, but she may agree to having a parent present during any and all discussions. We can also make recommendations on how to speak to your adolescent about contraceptive. In my practice, I do not prescribe artificial contraceptives. In my view, hormonal contraceptives are dangerous and can cause injury and death, and I believe it is not good medicine to prescribe these medications. Nevertheless, our center treats and manages many women who have been prescribed and are currently taking them. We are very knowledgeable about contraceptives and their mechanisms and their risks and side effects. But I believe there is never a reason to prescribe a contraceptive for an underlying medical problem. It's far better to diagnose and treat that problem outright.